going to sort of dash between my couple of hats between being at HUD right now and my 45 years of being in Health and Human Services. And option 2 are around beginning to look at how to make sure housing built for people with disabilities is used by people with disabilities. I ran smack into this one because I came in and said, I don't want housing filled unless we have a person with disabilities. And we did that, and at the same time I was trying to increase the set-aside, and frankly, real quickly ran into the developers who said, you're costing us money. Some apartments are staying open for months. We can't manage if we don't have people, which led me to try to solve the problem, which was trying to establish in Pennsylvania a clearinghouse, so that we always had people to go into the apartments. Because it seemed silly to me to have a waiting list of people with disabilities who needed the housing, and I had housing and we couldn't make the match. So the issue was that we wanted the apartment filled within 30 days. I think the developers would have liked even shorter, but they were willing to work with us around 2 to 4 weeks. But we had to figure out how to make the match with people, still give them choice, still have the issues there, and did find ways to do that. But it was critical to understand if we wanted to increase the set-aside, and I'm asking them to put aside as much as 20% of their housing, I also had to figure out a way to keep that housing filled. And I see that very much as federal guidelines, but state action, and to be able to make it happen, and some level of statewide clearinghouse. Along with that, one of the things that Jennifer didn't say that I am doing now, and I have to tell you it's added tremendously to my wealth of information and confusion, is I'm now operating the Philadelphia Housing Authority. I am their single-member board. So I've learned more about housing authorities at this point in time in vouchers than I ever thought I would or needed to know. However, one of the things is that they also, too frequently for me, allow vacant units, don't hold those vacant units for people with disability, and they are used by people who don't have the disability. But one of the things that I have encouraged them to do is more talking communication, because many times the disability is adding grab bars, maybe switching out a toilet, or doing things that are easy adaptations in an apartment. It's not the major renovations of some of our apartments, which do need to make sure they're used correctly. But there are other things that we can do because of having that level of maintenance staff, that they should be able to adapt an apartment that is available to make sure it's handicap accessible for folks. So some of it is looking at where those options are and making them work. The other one is making sure when you have someone who's going into an accessible apartment that doesn't need some of that support, is they know that they will be moved on a 30-day notice if we have someone who's ready. Those are all within the purview of being able to do and to handle, and to make sure that people are aware of that they will be moved to another apartment. You aren't putting them on the street, but you're trying to make sure the system is working. It needs to be managed, not just there. I want to also talk about 3 and 4, so I will move pretty quickly. So while Carol and I may have a slightly different perspective, I think we pretty much came together on understanding the role of the developer to have the housing full, and the responsibility of both HUD, state, and housing authorities to make sure that those units are for the right people. On option 3, it's the use of housing choice vouchers, and to increase the percentage of people with vulnerable populations, people with disabilities, and other populations. Clearly, when I've come into HUD from Health and Human Services, and part of my reason for coming here after being so long in the Health and Human Service system is that probably the most consistent barrier across all fields of social service was housing. And, you know, that probably people will tell you that I have said many times, if I had the housing, I could close the state hospitals, I could close the developmental centers, I could solve my child welfare problem, I could make sure people were housed, and things would take. And without housing, all of those things became more difficult. So coming to HUD was to help me understand, I'm not sure why I chose the last 2 years of my career to do it, but it has helped, to understand why, indeed, what can we do to be able to get the housing mix and the people mix. Because indeed, for almost all of these populations, if housing were available, we cut our cost. It's significantly less expensive to keep people in integrated community housing than to have them in institutions, or to have them in hospitals, or to have them in nursing facilities, or to have them in the foster care system. I mean, you can go almost down my list to see where that match can be. In getting into HUD and into the housing authorities, I understand why it's difficult. I'm not sure I've changed my perspective, but now I understand some of the complexities of how this has to work and how the solutions have to come about. So indeed, again, I believe so much of the devil is in the details, how you do it, who's doing it, and to make sure that by increasing availability, particularly for our most vulnerable populations, we aren't making another population more vulnerable. And probably the one that the paper didn't mention as definitively, that I think is still one of those that I continue to deal with, both from the HHS perspective and from being with the Housing Authority, is those vulnerable families that are still involved with the child welfare system. In other words, what's keeping reunification from happening? It's not that someone in the family has a disability. What's keeping unification from happening is that there's not safe or affordable housing for these families. And how do we make sure that that as we increase the percentage and availability of housing for our most vulnerable populations, how are we assuring that we just haven't made it worse for someone else? I think there are ways around this. I think there are ways to do both. I think there are changes that have to happen in our public housing programs and our voucher programs that would increase the probability that that we serve more people with disability. But I think it has to be one of those that we look at who we're serving, we look at the percentages, we look at the vulnerability, and we make that better match. And we begin to find creative, appropriate ways to move people through public housing. I don't believe that I had someone come up to me in Philadelphia who wanted to know if she could bequeath her housing unit to her son. And I knew we were in trouble. But I would tell you that is not, it may sound bizarre, but I don't think it is to people. They really believe this is their home, like we believe it's our home, and that they have sort of a right to be there forever. And it's, we need some creative thinking about how do we make sure that folks see this as somewhere that is there to sustain them, but not forever. And it's a real tough target because we do talk about it as homes. Touching on number 4, which I know is probably where I spend more of my time right now than any other single area, is working between HUD, whether it's multifamily housing, different components of public housing, and our research and development unit is trying to get a match with our fair housing unit. How do we clarify our emissions policy so indeed people can know what it means? They have some assurance as they take on folks with disabilities and vulnerable populations, that indeed we will be able to sustain that over time. How do we find the right balance between civil rights and allowing folks at both state and local levels to make choices that will indeed enable our most vulnerable population not to have to go through too many hoops to be able to get to the right place? How do we, again, to make sure that the providers, counties, systems, cities are able to make sure that our vision of providing these services for our most vulnerable populations, again, don't infringe on the civil rights of another population. Again, I think we can do this. I think we can make it a lot clearer. And I think we can make it reach a point where folks can read it and understand it, as opposed to read it and try to find someone else to explain it and find someone else to explain that. This is a tough topic right now. We have some pretty avid people who are into protecting rights and some pretty avid people who are trying to make sure people with disabilities are in housing. And I won't call me collateral damage in the middle. Right now I'm into shuttle diplomacy. But I will tell you, one of my goals before I retire is to get this one done. And for those who think that's forever, I'm retiring in about less than 2 months. So have a tight time with
I'd
it.
like to see you get this one done before you retire.